What's up, everyone? Welcome back to the Weekly Shot, where I dig into the latest in GLP-1 medications and metabolic health. I'm RMZ. Welcome to my channel. This week's lineup, a huge new study showing GLP-1s can protect your heart regardless of the amount of weight loss. Also, a surprising connection between obesity, immunity, and cancer risks. Eli Lilly also expands GLP-1 access globally. U.S. costs and insurance pressures keep rising, and a new brain research uncovers exactly how these drugs quiet hunger signals. And finally, the darker side of cultural pressure and postpartum GLP-1 use. Let's jump in. Big news for heart health and GLP-1s. A massive new study out of University College London just found that semaglutide, which is the active ingredient in Ozempic and Wegovy, may protect your heart even beyond its weight loss effects. The study followed over 17,600 participants aged 45 and up, all with cardiovascular disease and higher body weight, but no diabetes. Researchers compared people taking semaglutide to those on a placebo, and here's the headline. Patients on semaglutide had a significantly lower risk of adverse cardiovascular events, things like heart attacks and strokes. And here's why that is really interesting. That reduced risk showed up early, and it didn't depend on how much weight someone lost or how many inches they trimmed off of their waist. After 20 weeks, smaller waist size did link to better outcomes, but waist size alone only explained about 1/3 of the total heart benefits. That means semaglutide may be doing something more than just shrinking fat. It might actually be changing underlying cardiovascular risk factors in other ways. This is the largest study of its kind, and it adds to growing evidence that GLP-1 drugs could be powerful tools not just for weight management, but also for heart health, even in people without diabetes. Of course, side effects are still a concern, and more research is needed, but these findings could reshape how we think about GLP-1s and cardiovascular care. Here's one you might not have heard of yet. Researchers at Duke University School of Medicine report that obesity weakens cancer immunity, and GLP-1 drugs might help turn that immunity back on. In obese mice, cancer vaccines didn't work nearly as well compared to lean mice. But when those obese mice were given GLP-1 receptor agonists, tumor growth slowed dramatically, and immune response improved, almost matching that of lean mice. What this suggests is that GLP-1 medications could be doing far more than weight control. They might actually recalibrate immune function and alter the tumor microenvironment. Now, this is early stage research, but if confirmed in humans, it could redefine how we view metabolic drugs and cancer prevention and therapy. Imagine GLP-1s as both metabolic regulators and immune modulators. That is a huge step forward. Eli Lilly just announced a major partnership with India's Cipla Limited to bring Mounjaro to the Indian market under a new brand name, Your Peak. Lilly originally launched Mounjaro in India back in March, but through this new deal, Cipla will now distribute the medication nationwide. The partnership allows Lilly to tap into Cipla's extensive distribution network in India, expanding access beyond major metro areas and reaching millions more patients. This is a big move. India has one of the world's largest populations affected by diabetes and obesity, and wider access could make GLP-1 treatments more affordable while driving global competition in the space. The timing is also strategic. Novo Nordisk's patent for Wegovy expires in March 2026, paving the way for generics and a potentially massive shift in the GLP-1 market. It's not just a business expansion, it's the globalization of metabolic medicine. And for those of us following the science, more markets mean more data, more diversity in results, and hopefully lower prices everywhere. Here in the US, the story is money, and it's always about money, and a lot of it. A new Market Watch report says employer-sponsored insurance premiums could spike in 2026 due partly to GLP-1 coverage. These drugs can cost over $1,000 a month, and as prescriptions rise, insurers and state budgets are feeling the hit. Some state Medicaid programs are already limiting coverage or requiring stricter prior authorization. Now, I don't want to put all the focus on the increase in premiums on GLP-1 drugs. Are they a factor? Absolutely, but premiums are skyrocketing across the board for both employer-sponsored plans and ACA marketplace coverage, regardless of whether these plans even cover GLP-1s. That said, demand for these medications is outpacing what the healthcare system can handle. Until pricing and reimbursement catch up, access will continue to be uneven. If you're considering one of these treatments, make sure to review your insurance coverage carefully before starting. Over at Northwestern Medicine, scientists just published a study pinpointing exactly how GLP-1 drugs work in the brain. They found that these drugs suppress very specific neural circuits that control hunger and increase feelings of fullness, and they're localized in the hypothalamus. These neurons are known as AGRP neurons. Research has shown that AGRP neurons play a key role in protecting the body from starvation. When the body loses weight and enters a negative energy balance, these neurons activate to increase appetite and drive food intake. Semaglutide and tirzepatide work by counteracting this natural hunger response. Now of interest, researchers discovered that GIP, rather than GLP-1, is the critical hormone for sending signals to AGRP neurons that regulate the gut-brain communication. Not only does targeting the GIP receptor strongly suppress these neurons, but it also plays an essential role in everyday feeding behavior and gut-brain signaling around meals, explained Dr. Lisa Butler, senior author of the study. Looking ahead, Butler's team plans to explore exactly where in the brain GIP is detected to send these inhibitory signals to AGRP neurons. We don't believe GIP acts directly on AGRP neurons since those neurons don't express GIP receptors, Butler stated. It appears to be an indirect circuit effect, and we're now trying to pinpoint where that circuit begins. So that I'm not as hungry feeling that you feel isn't just willpower, it is neurochemical. For anyone who's struggling with weight or cravings, this is validation. It's not just about disciplining, but it's biology. And understanding that biology may lead to next generation drugs that target these brain pathways even more precisely, with fewer side effects like nausea or fatigue. It's the science of self-control literally being rewritten at the neural level. Finally, a story from The Guardian profiling new mothers in the UK who feel intense pressure to use GLP-1 drugs right after childbirth to, quote, get their body back. Some are even seeking prescriptions while breastfeeding, which doctors strongly advise against. This matters because it shows how quickly medical innovation can get tangled with social expectation. If you're using GLP-1s, make it a health-based choice, not a cultural one. No medication replaces mental wellness, self-acceptance, and patience. So to recap this week, GLP-1s might help your heart regardless of your weight. They might reawaken your immune system. They are expanding globally. Cost and coverage are heating up. Brain science is unlocking new mechanisms, and social pressure remains a major factor. I'm RMZ. Thanks for watching The Weekly Shot. Don't forget to hit that like and subscribe and share this with someone following the GLP-1 revolution.